Leaders from across the globe have sent messages of support for British Prime Minister Boris Johnson, who is in intensive care after his coronavirus symptoms worsened yesterday. The 55-year-old has been given oxygen but is not yet on a ventilator, with authorities saying he has a persistent high temperature. Messages of support have been sent to him from US President Donald Trump, French President Emmanuel Macron, and Japanese Prime Minister Shinzo Abe, Canadian Prime Minister Justin Trudeau, amongst others. The UK has over 52,000 COVID-19 cases and over 5,000 deaths. Let's cross live now to our colleague in London, Holly Hudson, for the latest. A very good morning to you, Holly. Give us an update on the British Prime Minister.
We've had no further updates on the Prime Minister's condition overnight. He has spent the night in intensive care in hospital next to me here in South Central London at St Thomas's Hospital, less than a mile away down the road from Westminster. Now, the latest from officials last night was that he remained conscious, was not on a ventilator, although they did confirm that this may be necessary should the symptoms persist. Of course, this won't be a decision that was taken lightly by his doctors. He was admitted to hospital on Sunday night. Now we're told his condition worsened over the past 24 hours, 10 days after his initial COVID-19 diagnosis. And no doubt this is a very alarming and unsettling news for the country. Those at the top have sought to reassure the public. Dominic Raab, the second in command, essentially, shortly after the dramatic announcement last night, said that the Prime Minister was in safe hands, receiving excellent care, and vowed that the government would bring the whole country through the pandemic. And as you say, well wishes have been coming in from not just politicians in the UK, but world leaders, including Emmanuel Macron, Angela Merkel, Donald Trump, who says he will do anything he can to help his friend Boris Johnson, saying he's been something really very special, strong, resolute, he doesn't quit, doesn't give up, adding that he'd been in touch with leading companies who've been working on possible treatment solutions in the US. Now, we have also heard from Cyril Ramaphosa in the last few minutes as well, who tweeted wishing Boris Johnson a full and speedy recovery, said he's sending his support to him and the people of the United Kingdom. We are going through a most challenging period, but we shall overcome. Our thoughts are with him and his loved ones at this time. And of course, Britain's prayers too with the 55-year-old Prime Minister and his family, because he is, of course, expecting, he has a child on the way with his fiancée who is pregnant, Carrie Symonds. She is recovering after suffering symptoms herself. So the nation this morning anxiously hoping that he recovers from what is clearly a very severe case of COVID-19, proving that this disease does not discriminate.
Holly, thank you for that update about the fiancée, because that was going to be my next question in terms of concern for her and her health.
Yes, of course, a very, very concerning and worrying time for the British Prime Minister and his family, but of course the nation too. The country is in its second week of lockdown, entering its third week of unprecedented strict curbs on personal freedoms here in order to try and limit the spread of the coronavirus. Britain approaching the peak, the curve of COVID-19. So this couldn't have come at a more unprecedented time, a time of national emergency. The Prime Minister even referred to himself in his address to the nation just over 2 weeks ago. We have seen Boris Johnson in the past 10 days following his diagnosis. He has popped up several times on social media, and he was seen clapping outside Downing Street on Thursday during what has become what we call here a clap for carers, where people stand outside their homes hands and clap for the National Health Service and people on the front line battling this crisis. He didn't look well then, and there have been concerns that he has been more ill than Downing Street have been willing to let on. Now, in his place, Dominic Raab, who, as I say, is the second in command, the Foreign Secretary, the first Secretary of State is his official title. He will now step up. The Prime Minister has formally asked him to deputise for him where necessary. So he essentially becomes the de facto Prime Minister at what is an unprecedented time of national emergency. He did, though, say that there is an incredibly strong team spirit behind Boris Johnson, and that ministers will focus on delivering the plans he had put in place. So those at the top very keen to project an image of stability, to try and reassure the nation that the machinery of government will keep working, the wheels of Whitehall will keep turning. They've had their instructions and the cabinet will rally around him. That's the sort of message that we're hearing from senior ministers this morning. But of course, will present its challenges. A government without its key figurehead at this very crucial time. A leader, of course, necessary for a nation at this particular time. And the government battling on behalf of the country, and now with a Prime Minister very much facing his own personal fight against this disease.
Of course, Dominic Raab coming in at this interesting time. Has he been officially installed, and when is he addressing the UK nation in terms of what are his immediate deliverables?
Well, he says that the government will be carrying out the Prime Minister's instructions, that they already know what to do. The Cabinet will rally around this morning and continue to do that work, carry out the instructions from the Prime Minister. The position, of course, up until late yesterday was that Number 10 will continue, that Boris Johnson would continue, that he was still working from his hospital bed. Of course, his condition has now clearly worsened to a point that is now no longer possible. So Dominic Raab will be that key decision maker at this sort of crucial time, but they already are working on a strategy to cope with the virus. And we are hearing that there are signs that the rate of infection in Britain is working. We were told by medical bosses yesterday that the efforts of the British public to stay indoors, only to go out for those essential trips for medical care or for that one bout of exercise, are seemingly working at the moment. Of course, Britain remaining cautiously optimistic, hoping and looking across to other countries in Europe, Spain and Italy, which too have seen sort of slivers of optimism in their rates of infection, with their number of deaths falling. The number of deaths here does continue to rise every 2 to 3 days still, but hospital admissions are seemingly slowing down. There is still no talk yet of ending the lockdown, according to the chief medical officer. They need much more time, much more data to be able to make such an important decision as lifting these restrictions. So, of course, without a figurehead, without a leader at this point, will be very unnerving for the country. And Dominic Raab will be hoping to reassure the nation as it hopes for a very swift recovery for the Prime Minister. We'll be hoping to get some kind of update on his condition later today.
Holly, the other conversation around the COVID-19 outbreak is the protection of healthcare workers. What's the situation like in Britain?
Yes, there's been much criticism made of the government's response here, whether it's been too slow in terms of not just mass testing. Of course, when you hold up Germany as a sort of pretty damning mirror to the UK in terms of its rate of infection, its rate of deaths, Germany, of course, has diagnostically much more diagnostically advanced than the UK, has been mass testing on a much wider scale than the UK, and has seen a much much lower rate of infection and death. So much criticism aimed at the government over that, but also crucially the lack of personal protective equipment. Now, the government maintain that they are delivering hundreds of thousands of masks and gowns to hospitals and care workers on the front line of this crisis, but we're still hearing from people in hospital, doctors and nurses, that they don't have enough of that PPE, that personal protective equipment, and the same from people on the front line in social care and even people working in supermarkets too. So a real effort needed from the government on that. They do maintain that they are working on it, that they're around the clock to deliver that equipment to enable frontline workers to continue to carry out their job and treat infected patients here.
Thank you so much for that update, Holly. Remember that